Morning, everyone. Let us pray. Heavenly Father, we ask for your presence here today as we continue this meeting of the Finance Committee. Father, we ask for your blessings over all honorable members and for those who have joined us here today. We recognize that despite whatever differences we may have, we are all working towards one common goal. Father, we ask for your continued blessings and protection for these islands and all of our people. We ask that you guide and direct us today so that all we say and do will be in your favor. All these things we ask in the name of your Son, Jesus Christ. Amen.
Amen. Please be seated. Proceedings are now resumed in this Finance Committee. This morning we are looking at examining the appropriations to the Minister of Health, Environment, Culture and Housing. We do have a number of members on both sides of the House that are unavoidably detained at this time, but I know that they will be making their way down as soon as they can. But we are quorate, and so I'd like to proceed with the business of the committee. We are going to begin our examination of HES 1, Policy Advice and Ministerial Services for Health, Environment, Culture and Housing, for $3,694,000 in 2018, $5,674,000 in 2019. Are there any questions? Member for Bodden Town West.
Good morning, Mr. Chairman. Thank you. Through you, sir. I noticed the annualized cost is moving from roughly 1.8 million to more than doubled into almost 3.7 million. And I'm trying to figure out what it is that is driving literally more than 100% increase in cost. Thank you.
Thank you, Mr. Chair. Through you, I'll have the Chief Officer answer that question. Thank you.
Can I ask you to state your name and position, please, for the record?
Good morning. Jennifer Hearn. I'm the Chief Officer in the Ministry of Health, Environment, Culture and Housing. Through you, Mr. Chair, there's a number of different factors that are contributing to that increase in expenditure over the next 2 financial years. One of them is to do with the long-term residential mental health facility coming online in 2019. We also have the increased costs to do with the Integrated Solid Waste Management System project, ongoing procurement and contract award, which is reflected both in 2018 and 19.
Thank you. Through you, Mr. Chairman, I noticed that I'm assuming then that it is executive assets that we'll be purchasing, thus driving the increase.
Through you, Mr. Chair, the Integrated Solid Waste Management System is not an executive asset. It's a triple P procurement. And the long-term residential mental health facility procurement and capital cost is separately in the equity injection for the ministry. The costs that are in this output are to do with the actual operation, the operational costs of that facility once it comes online.
Through you, Mr. Chairman, is it mean then it's like staff head count increase? Is that what's driving it? I'm just trying to understand a more.
Through you, Mr. Chair, there are a few different factors going in. There's an overall increase that we're seeing across the board due to the pay stagnation that was implemented in the current financial year. So some of this increase is a reflection of that. There are a few additional posts that are being proposed in a couple of the departments within the agencies in our ministry, which are also contributing to this cost as well. But the largest single contributors, as I mentioned, are the Integrated Solid Waste Management System and the mental health facility.
Through you, Mr. Chairman, roughly what are the costs just for this ballpark for the solid waste and the mental health facility?
Remember, when you say the cost, you mean the actual capital
Yeah,
cost?
yeah.
Okay.
Sorry, the capital cost, Mr. Chair? So through you, Mr. Chair, the capital costs that we've included in our budget, and these are reflected in the equity investment later on in our appropriations. For the mental health facility in 2018, we have $5 million, 2019, $8 million. For the integrated solid waste management system, we have in 2018, $1.3 million and $655,000 in 2019. For the integrated solid waste management system, for the landfill remediation, and this is for the closure and remediation of the 3 landfills, Grand Cayman, Cayman Brac, and Little Cayman. In 2018, we have $4.6 million. In 2019, we have $8,050,000.
Mr. Chair. Mr. Chair. Morning, and through you, and morning to the Chief Officer. Based on the fact that we have projections for the amounts needed for the solid waste management, and we haven't got a signed agreement yet, a full signed agreement, do we have an idea of the exact cost since we're already budgeting for it?
Through you, Mr. Chair, the member is correct. We don't have an exact cost as yet because we are in the process of finalizing the contract. The figures that we have included are based on the outline business case cost estimates that came through, and as has been mentioned in the media releases regarding the preferred bidder, the costs that have come in with the bid are in line with those OBC figures, which is why we've used those for budget purposes.
Mr. Chairman?
Yes, sir.
Could we get an explanation of how we arrived at a decision on the bid without having finalized contracts and knowing exactly what we're going to end up with? Just an understanding of the process we went through. So we don't have finalized contracts yet. We don't have a finalized solution yet, but we've assigned, obviously, the contract to one bidder. How did we get to that point? And how are we certain that we've arrived there in a manner that we're not surprised by anything later on?
Through you, Mr. Chair. For the procurement of the integrated solid waste management system, we've been following the process that's laid out with the framework for fiscal responsibility. We've been in procurement for this project for a number of years now. We started with a strategic outline case, which looked at the need for the project and what were the areas that we were trying to address. We also came to the realization that one of the things that we needed was a solid waste management policy to guide us in terms of what we wanted to achieve with delivering this project. From that, we moved on to looking at an outline business case. The outline business case assessed a reference project, which contains a number of components, and made a recommendation as to how it should be procured and delivered. From the outline business case, the recommendation was, or they found that it was technically feasible, it was bankable, and it would meet the needs that had been identified through the strategic outline case. And it also came up with the recommendation that the best way to deliver it was through a public-private partnership. The outline business case included an assessment of the financials and an estimated cost, looking at all of the various factors that were part of the project. The project is an integrated system. It's meant to be a 25-year solution for the waste management issue for all 3 islands. It includes household waste recycling, composting, waste-to-energy plant is one of the big pieces in it, and also looking at waste reduction efforts as well. When the OBC was done, as I said, it came out with some estimated costs, and it was on that basis, looking against those, that we put the figures in the budget. And so the OBC, as I was saying, identified and confirmed that the project as proposed was feasible and that a triple P was the best way to do it. We then embarked on the procurement process to identify the preferred bidder, which is the point that we've reached now. So we put out a request for proposals to shortlist some contractors. From that, there were 3 contractors or 3 bidders that were pre-qualified, and we then entered into a competitive bid process with those shortlisted bidders. The shortlisted bidders then worked with the technical team to go through the bid, through the RFP, and based on the bids that we received at the end of that process, the recommendation was to go with the preferred bidder who we've identified. The preferred bidder's proposal was rated the best on all the aspects that they were assessed against, which was the technical expertise, the experience, and the finances.
Just
Well-
want,
Sorry, you want to add something?
yeah, just want to add something. Thank you, Mr. Chair. I just want to say that this process has been going on even before I arrived in May 2017. And I must say that I'm very proud of the work that has been done thus far, and the methodical way that they've taken the process. When I came in, I asked, when is this going to finish? Because we want quick wins. And they said, no, we have to follow the process, and it's going to take a while. And it's not going to be before next year we can break ground, and then it's not going to be before 2021. I was very happy that they were taking every measure possible to ensure that this problem that this vexing problem that the country has had for many years, many ministers has tried to solve, many administrations have trying to find ways to achieve this outcome. And we now have a solid plan that has been vetted even by CTC and all, and on track to be completed within our term. So I just want to say thank the team for that, actually.
Member from Newlands.
Yep. Thank you to the minister for that. What were the required qualifications for the bidders to be selected or even shortlisted?
Mr. Chair, through you, the pre-qualification that went out looked at a number of different factors, including experience with similar sized and similar types of integrated waste management projects, successful delivery of those projects, looked at the ability to finance the project, as well as the technical expertise of the different teams that they were bringing to the table. The bidders all came in consortiums, and those were the types of things that were assessed. The criteria were laid out very clearly in the RFP that went out for the pre-qualification. I don't have it in front of me now, but I'd be happy to provide it to the member if you'd like me to do so after we finish today.
Okay. And as far as experience goes with similar size projects and scope, what is the selected bidder's experience?
Mr. Chair, thank you for that question. And what I want to say is to reiterate what the chief has said, is that all the teams brought a consortium, because when you're attacking, when you're trying to resolve a problem the magnitude of this, you need to bring a consortium, and that's one company bringing other entities together who have the expertise in the areas that we need to achieve, and that's so it's just not just one company with the experience; it's the consortium.
Go ahead.
Thank you, Mr. Chair. As I mentioned, I can't recall exactly the years of experience or the number of projects. I would have to refer to the document, which I don't have in front of me, but I will provide that information to the member after.
Mr. Chair.
I had to member for
Button
Button
Town.
Town West.
Thank you, Mr. Chairman. I'm sorry, I'm just trying to really understand the increase of the almost $2 million in annualized costs. And I'm hearing a lot of different stuff, but if you look at the bottom of page 207 on the planning estimates that deal with this, it says that the group compromises budget statement outputs MHE1, MHE2, MH3, and MHE7. And when I look at MHE1, the cost is going up roughly little over $700,000. And the description of MHE1 is the provision of administrative service for the minister and cabinet, including production of cabinet papers and notes, production of speeches and statements, production of answers to parliamentary questions, replies to correspondence, and initiate and research information for press releases. So that is going up roughly $723,000. Then when I look at MHE2, which is development of legislation, I'm seeing the provision of original and revised draft and instruction for revision and creation of the following laws: cancer registry laws, human tissue transplant regulations, pharmacy law regulations, mental health regulations. That's going up by almost $400,000. Then you have MHE3, which is policy advice to the Minister of Health, Environment, which this description is conduct research and review of services to provide policy advice to the Minister of Health and Culture and Cabinet on the following: health, environment, and culture. And then MHE7, which is going up by almost $200,000, is basically says to monitor the performance of statutory authorities, government companies, and non-government organizations. So based on these descriptions here, this more sound like an administrative increase, but we're hearing, I guess, something different, and I'm just trying to understand, reconcile what is said here as a breakout versus what is actually said. And I'm not getting an explanation in terms of these increases in administrative costs based on the descriptions provided in the budget statement that was given to this honorable House.
Through you, Mr. Chair. Some of the figures that we have, as I said, for the mental health facility, that's $1 million in 2019. For the integrated solid waste management system, that's $1.4 million in 2018 and $2.6 million in 2019. We have $940,000 in 2018 and $730,000 in 2019 for Oxytec, and there's $1 million as well for the iguana management program. In addition, as I responded earlier as well, there's also factoring in for the pay stagnation, which was addressed in the current financial year that we've had to account for going forward. There's also been some changes in that we've had some movement of staff with the changes in the subject areas at the ministry level, and there are a few new posts in some of our departments.
Sorry, Mr. Minister, through you, Mr. Chairman. Just so we're on the right thing, the description of this is policy advice and ministerial services for health, environment, culture, and housing. It has increased 1.9 million. And based on the descriptions here, with regards to what is driving the increase, this is more policy advice. So the question is, which I'm trying to reconcile, $1.9 million of policy advice. What is driving 1.9 million increase in policy? I mean, the policy is really what I'm trying to get at based on the description.
Mr. Chair, through you, the output description that's on page 207 is the rolled up output of the ABS statement outputs as well. One of the things that's reflected in this rolled up output is some of the policy advice that the ministry gets at the departmental level as well. So this reflects some of the increases I said at some of the departments. It's not just an increase at the ministry level in terms of the policy advice. The figures that I've mentioned are some of the major drivers that are contributing to this. So for example, we would expect going forward that the costs related to the integrated solid waste management system, once the procurement is completed, those costs will come down within the ministry's budget, but they'll be reflected, the actual operational costs of that project will be reflected in a different area of the ministry's budget. There are, as I said, there's some pay stagnation, there's some changes in staffing as a result of the subject changes and so on that are all contributing to the increase that you see between the current financial year and the projected financial year.
Mr. Chair.
Member for Georgetown Central.
Thank you, Mr. Chair. Through you. In respect to the solid waste management agreement, without giving out too much details, because I know it's at a sensitive stage right now for the department, my question is mandatory recycling going to be a part of the long-term plan? And if so, will there need to be any legislative changes at all, particularly to recycling and any other part of the agreement in respect to making sure that this plan is successful?
Through you, Mr. Chair. At this point, it's not envisioned that the recycling would be mandatory. It's certainly a major component of the project. The issue around legislation, and we do anticipate that we will need to amend the legislation to reflect the provisions of the system once it's online. But at this point, we haven't determined whether we would make a mandatory recycling. But the recycling is a component. There are diversion targets that are part of the procurement and part of the performance standards that the contractor will be required to meet.
Through you, Mr. Chair, in respect to a follow-up question. In respect to the agreement, again, without trying to prejudice the information about it, has there been considerations to whether or not if there's going to be a need of extra employees to make this plan go through? Has the ministry considered having an agreement in there to make sure that there are Caymanians that are going to get those extra jobs if there will be? I just want to know that it's been considered and thought about to make sure that, because we're contracting this out, we want to make sure that the company, whoever it is that finally agrees to it, will make sure that Caymanians become the priority in respect to employment for it.
Thank you, Mr. Chair. Certainly, I agree with the members' comments, and just want to say that one of the first things that was done to ensure that we protected Caymanian jobs were to carve out collections, which is still with the government and won't be a part of this ISWIM's contract. This is not to say that collections won't be privatized, but it's not a part of this, and it was carved out to ensure that we protected the Caymanian jobs. So you can just see by the way it's starting that we were already thinking about ensuring that Caymanian jobs, or jobs that are mainly Caymanians are employed in, was protected, which is collections.
Mr. Chairman, back to the qualification of bidders. I understand the Chief Officer saying that she doesn't have the information here, but I think it's important that the committee satisfy itself that the selected bidders are indeed qualified and experienced. Is there any way that we can get that information?
Through you, Mr. Chair, just a question of clarification. You want to know what the assessment criteria were that we used when in the request for pre-qualification of the bidders?
The criteria and also the results. We'd like to know that the selected bidder does have the experience level and meets all the criteria.
Through you, Mr. Chair, we will get that in the next, we'll get the details regarding the RFP qualifications in the next few minutes. Just going to take us a few minutes to dig it up
That's fine.
and be able to speak to it then.
Sorry, through you, Mr. Chairman, just so I'm clear and that we know exactly what it is that we're voting on. The 1.9 million increase in policy advice to the minister, that is driven by staffing pay and staff increases, largely increases in staff pay, and I'm assuming that there'll be some consultants that will be brought in to provide policy advice with regards to the mental health facility and the solid waste management, because policy advice is a human cost. It's a personal cost.
Through you, Mr. Chair, the member's correct. As I said, one of the main drivers in the increase is associated with the integrated solid waste management system procurement, which represents some consultancy fees, some professional fees that will be required, as well as to do with moving forward with the long-term residential mental health facility.
Okay, through you, Mr. Chairman, just so of the 1.9 million increase in costs, what amount is really related to pay stagnation, and what amount would be to the professional consultants?
Sorry, through you, Mr. Chair, the member's asking for a breakdown between the professional consultants
And staff costs, because I mean this is more a personal increase. I mean it is policy advice. So we're trying to understand what's driving the increase. Is it from staff getting paid more money, or we're bringing in more consultants? That's what I'm trying to understand, the increase of the 1.9 million.
The 1.4 million, through you, Mr. Chair, the 1.4 million in 2018 is mainly associated with professional fees for the ongoing procurement and contract negotiations for the integrated solid waste management system. And in 2019, there's $2.6 million, which again is almost entirely to do with the professional fees for the ongoing procurement and delivery of that system.
2.6?
That's correct.
Okay, so consultants is 1.4 million this year and 2.6 million next year. And I'm assuming the balance then of 500,000 thereabouts would be for the staff.
And there's also, through you, Mr. Chair, in 2019, there's $1 million that's in there for the operation of the commencement of operations of the long-term residential mental health facility. So that will be to do with staff and operational costs of that new facility coming online.
Well, the bulk of it is actually consultants. Thank you, Mr. Chairman.
I think the member from Central had a question. I'll go on.
Member for Georgetown Central.
I think the minister wanted to
Sorry,
comment
thank
first.
Thank
Go
you. I just wanted to allow us to answer the question from the member from Newlands. So I'll allow.
Good morning. Jim Schubert, and I'm the Senior Project Manager for the ISWIMS project, and through you, Mr. Chairman. Just to give some further background on the PQQ process, there were technical requirements, as Ms. Jennifer mentioned, that dealt with the size of facilities. So we knew what the reference project was, and there were key facilities specifically involved with composting and the waste energy components, and we had design requirements for that. So we wanted them to demonstrate they have built facilities in the size range that we needed, and they also had to have done that over a period of time. So we didn't want new technology, we wanted proven technology. So they had to provide 3 references with a minimum, I believe, 3 to 5 year operational experience. And the preferred bidder, or the pre-qualified firms that we selected, all demonstrated that. As far as with the preferred bidder, their consortium is basically based from companies that are European in nature, so they're all UK or Scandinavian suppliers. They also have a US consortium member, as well as a member out of that has done work in Barbados, so, and a local consortium member. So Island Recycling is one of the companies, so there's local, there's international, as well as some North American consortium members. the other part of the PQQ process was financial. So they had to demonstrate that they could actually fund and finance this project. It is a 25-year project, so they have to come up with all of the capital, operational maintenance funds over the 25-year period. So they had to demonstrate to us that they had actually done that successfully on other projects, which was part of the pre-qualification process.
I have a question, Mr. Chair, but I think from a timing perspective, the member for Newlands probably wants to respond back to him because I'm going to go on to a different thing the chief officer said.
Member from Newlands, you have further questions for?
Yeah, thank you, Mr. Chairman. Just in terms of the scope of the project, at some point did we switch from remediating and mining the existing landfill to just capping it? Because I seem to recall earlier discussions were more along the lines of getting rid of it. Now we're talking about capping.
Through you, Mr. Chair. The member is correct that initially when we started out, one of the options that was being looked at to be included in the reference project was to mine and to try and get some of the landfill processed, the existing landfill processed through the system. Upon reflection and in discussions with some of the technical consultants that we had, a recommendation was made that it would make more sense to cap and not to mine. The challenge that they saw with mining the existing landfill, there were a few things. One, we would never get back down to zero. So it wasn't a situation where we would ever be able to utilize everything that is there and return the ground to an undamaged state. And the other issue with mining is that it would create a nuisance, or it would prolong the nuisance. So if you can imagine what it would be like to be digging up the existing landfill over the next 20 years, and it would be making the existing situation much worse. And the benefit that they saw potentially in terms of additional waste energy revenue wasn't significant enough to justify continuing and creating an even greater nuisance than what is there already. The other factor that was taken into consideration when the decision was made not to proceed with the mining was that the consultants had done some preliminary tests on the amount of landfill gas, and there's an opportunity to actually capture it once the landfill's been capped, to capture that landfill gas, and there's some potential revenue that could be brought from that as well. But I think the main concern was regarding the fact that we would never get rid of the landfill, the existing landfill, no matter how long we mined it, and that it would just be a tremendous nuisance that would be perpetrated in a number of years going forward, as opposed to what's being proposed now is once the landfill is capped, the nuisance from odors from the landfill will be mitigated.
Thank you, Mr. Chairman. In terms of capping and moving forward from that point, have we satisfied ourselves through maybe inclusion with DOE and so on, that is the best solution? Because I know there are some concerns in the community about leaching into the North Sound. My concern would be, I understand when you cap it, it actually secures it so that you don't have water penetrating and maybe flushing out toxins and so on. But is that solution going to withstand, for example, an earthquake? If there's which we have had in the past, so if there is an earthquake, are we confident that we're not going to create a problem later on?
Well, I think through you, Mr. Chairman, I think one of the things we found in the work leading up to this is the leaching or contamination from the landfill to date has not been as bad as what would be anticipated in other jurisdictions. And I think a big part of that has to do with the type of waste going in. There is no heavy industry here, so it really was municipal waste coming into the landfill, and the contaminants that were going into the North Sound and leaching into it were mainly organic in nature. So we will never be able to stop the amount contamination going into the North Sound, but the capping will definitely minimize that once it's done. And in an event like an earthquake, it won't disrupt, I think, underneath what's there, because there is no liner, unfortunately. That's just the case. But it shouldn't disrupt the liner on top of the cap on top of the landfill in any case. So, but it should be minimized. We cannot guarantee that it will never contaminate the North Sound, but it will be reduced.
Mr. Chair, through you, I'm glad to hear that the ministry is taking this approach in respect to not mining. I remember saying that some 3 years ago that would be a disaster, so I'm glad to hear that they're going that direction. But much of what is being said sounds so deja vu, because it sounds exactly similar to what the administration under the former Minister Mark Scotland had offered, which I think was good then. I'm just glad to see that we're going back to it, because that basically was offered was to cap it, collect the gas, and monitor it. But that was just a comment, and I apologize for using the time for a comment. I actually want to address a money amount that was allocated for the iguana management services that the chief officer highlighted just now. One of my concerns is that there's an employment opportunity here. I would like an outline of how that process is going to be outlined for the public and how they can get involved, because the last process for the iguana management was rather selective. Many people thought it was selective, and only so many people got the opportunities from a work perspective. And also to ask if there was another option available to the ministry, because from environmental protection perspective, one of my thoughts was, could there potentially be an opportunity for collection of these iguanas and then be shipped off to another jurisdiction that the green iguana was actually endangered? One of our neighboring countries, Honduras, has the green iguana endangered, and we have hundreds of thousands of them here. Is there a possibility, because I've mentioned it before, that the ministry investigate whether that jurisdiction would be interested in being a part of footing the bill for that transfer, but we still collect them here, and then we can replenish their stock over there that has been lost, because
Remember, I don't mean to break you, but I think we're straight into an area that is not being discussed at the moment.
Well,
it'll come later.
Mr. Chair, the only reason I brought it up is because she outlined the amounts that was for this particular, that was allocated in this particular line item. And she said it was, I think, 1.2 million.
Okay.
If this is not the line item for me to discuss it, I can bring it up later.
Okay, fair enough.
Sorry, Mr. Chair, through you, I have to apologize because I misspoke earlier. The figure that I quoted for the iguana management is actually to do with another output, HES 21.
Yeah.
So
I don't mind waiting till then.
that's coming.
Okay, so I can postpone that question and then till then. But for my comment, I am happy to hear that the ministry is deciding to cap and not mine.
And going back on that vein, Mr. Chairman, has the DOE endorsed the approach that you're taking?
Go ahead.
Through you, Mr. Chair. Again, this is HES 21, that the funding for the iguanas. Are you speaking about the iguanas?
No,
Or
the landfill.
approach for the
the
landfill?
capping of the landfill.
The capping, okay, I'm sorry. So the project has been done by a steering committee that's been responsible for framing the project. And the Department of Environment is a member on that steering committee. And in addition, they are also now, the preferred bidder is now in consultation with the National Conservation Council and the Department of Environment regarding the scoping of an environmental impact assessment. And I imagine that through that process, they'll also provide or we'll see what their advice is, their guidance regarding the capping. I believe that the view is that it will improve what we have now. So the situation that we have now, as our project manager mentioned, is it's an unlined landfill. As you've mentioned, when it rains, the water goes right through it. once the landfill has been capped, the amount of water getting into it and therefore the amount of leachate coming out of it will be reduced. So it would be an improvement over what we currently have. And with the delivery of the integrated solid waste management system, we will have an engineered landfill. So it will be lined, there'll be leachate collection, and it will be only for the ash. It'll be an ash monofill for the residual ash from the waste to energy plant. And we're projecting that we'll reduce the volume of landfill waste or waste going into the landfill by 90 to 95%. So right now we have about a 70-acre site, and we're anticipating a 4 or 5 acre site going forward for the next 25 years.
Okay. And the environmental impact assessment, I know there's talk about weakening some of our conservation rules with respect to impact assessment. So I just think the committee needs assurance, or at least I do, that regardless of what changes are coming, if that impact assessment comes back to say, no, this is not going to work, we don't anticipate legislative changes. We follow the advice given by the impact assessment.
I think it's a bit loose to say weaken. And I
Well,
think
in
the
my
more
opinion.
measured word would be balance.
Through you, Mr. Chair, we have always envisioned, as we've been progressing the project, that there would be an environmental impact assessment that we would need to do. I think it's important to recognize that the role of the impact assessment is to flag any impacts that need to be mitigated and to make recommendations for it. So that's not the decision-making point, it's a decision-making tool. If the impact assessment were to reveal, for example, that we needed to relocate a component of the project to mitigate some of the environmental impacts that were being projected, that's certainly something that we would need to take on board and look at. So I think, certainly I haven't had any indication that we need to try and do anything other than go through the current process for the environmental impact assessment. I think generally the feeling and the view is that we recognize that we want to make sure that this is the best possible project, that we find a long-term sustainable solution for this problem. And the steering committee has recognized, and I believe that that Cabinet has recognized as well, that having information to be able to make informed decisions is really key.
Mr. Chair, I'd just like to add that, this wouldn't just be the ministry making a decision to go around the environment, the EIA, but it would be a decision where the ministry would have to then send a paper to caucus for us to have a discussion and for us to advise the ministry what direction we want to take in terms of the matter at hand.
Yeah, I understand that. My concern is just that we follow that advice regardless of what changes may be coming later on. Because I understand the seriousness of what we're trying to do here. I understand the seriousness of the situation that we have on hand now. And, what I'd like to see happen is that we develop a solution that is not going to present any future risks and unanticipated consequences.
Well, I think, Mr. Chair, when we talk about take that advice, I think the advice that we really need to take is our constituents, because we can have all kind of advice here, and we still need to hear our constituents and what they want. So this is not a decision just for one person, and the government will make a decision if it comes to that juncture.
Mr. Chair, I have one last question in respect to this line item, and then I can
Last
move on.
question, and I'm going to put it to the vote.
Thank you, Mr. Chair. And through you, can the chief officer say, because she was through the chairman,
Yeah.
to the minister, to the chief officer, if possible, the difference between this potential agreement, because we're almost halfway there, and what was previously presented, because what I'm hearing is almost exactly the same thing as what was presented in the administration where the minister was former Honorable Mark Scotland. So if
Member,
there's
can
a
I just
difference, I'd like
ask
to
you,
know.
don't refer to him by his personal name, but rather just to the
To the
position.
time, okay, I apologize. To the administration of 2009 to 2013, the health minister at that time. Can they say if there's any differences, and if there is, what's the difference? Because I'm hearing a lot of similarities at this particular point.
Through you, Mr. Chair. Just first of all, to clarify that at the time that the member is referring to, this subject was not actually under our ministry. It was under another ministry's remit. So I was not actually involved with the previous procurement exercise that he speaks to. I can say, though, through you, Mr. Chair, that the member is correct in that a lot of the components that we're proposing to bring forward as this integrated system are similar. The differences are around what was actually going to be delivered to the government and what the government would then be responsible for delivering on its own. My understanding of the proposal at the time that he's referring to is that government would have been given a site with one or maybe two cells of engineered landfill and a master plan where all of the other components that we're now talking about delivering could have ultimately been done by government should government had wished to move forward with it. So the member is correct in terms of what had been proposed as the ultimate master plan at the time for the site that was being discussed was very similar in terms of the components that made it up. The difference in terms of what we're doing now is that it's all being delivered at the same time, and it's also looking to address not just Grand Cayman, but Little Cayman and Cayman Brac as well.
Mr. Chair, just to give the members some comfort, this has been a situation that we've been trying to solve for over 20 years, many ministers. And the process that we're taking now, the time that we're taking to ensure that we achieve the right result, the committees that we put together to ensure the right people are on there, DOE and all. There's no way that anyone should think that we're trying to go around of anything to try to achieve this. One of the things that I'm most proud about is that finally, because what has happened in the past is that we've had many good solutions put forward, but the government's run out of time and the new government come in and then everyone takes a new approach. This is one of the first times that one government will be able to actually put this in place before it actually goes out before the next election. Put it that way. So I'm very proud about that we'll be able to achieve this within this term, and that we're not trying in any way to go around any suggestions from any committees or departments or otherwise. Thank you.
Thank you, sir.
Thank you, Mr. Chairman. Just to make my position clear, I'm not trying to put up roadblocks, but I believe as an opposition member, I have to make sure that we satisfy ourselves from both sides that what we're proposing will work. And I am concerned about constituents as well, the safety and well-being of constituents. So, my point of view is I have to ask these questions. That's my job. Whether I agree with the project or not is irrelevant. I have a responsibility. So that's how I'm approaching this. So there's nothing personal or political about this. I believe I'm just sitting here doing my job.
I appreciate that.
Thank you.
All those in favor of HES 1, Policy Advice and Ministerial Services for Health, Education, Environment, Culture, and Housing for $3,694,000 in 2018 and $5,674,000 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. HES 2, Health Regulatory Services, $1,368,280 in 2018, $1,442,000 in 2019, Are there any questions?
Mr. Chair.
Member for Georgetown Central.
Thank you, Mr. Chair. Through you to the minister, is there any outstanding potential lawsuits against the HSA that are unresolved?
I don't think this is the appropriate section for that question.
You are 100% correct, Mr. Chair. I apologize.
Okay.
I'll deal with it in the next line item.
All right.
Mr. Chairman, on
Yes, sir.
to that point, perhaps the Honourable Minister, through you, can explain what these regulatory services cover.
Okay.
Through you, Mr. Chair, this is the output for the Department of Health Regulatory Services, the department who is responsible for both the Health Insurance Commission, which is the monitoring regulation of the health insurance industry, and the Health Practice Commission and the associated registering councils, which is responsible for the licensing of healthcare facilities and the registration and licensing of healthcare practitioners.
Mr. Chairman, as a follow-up to that question, just recently the Public Accounts Committee had these matters before that committee in hearings. And those hearings were derived from a recent Auditor General report suggesting that healthcare costs are on the rise in the Cayman Islands. However, there's little critical data coming from the healthcare system to explain those increases in costs. We have all seen the government response to either increased budgets or write off bad debts. This is unsustainable, Mr. Chairman. The information on the performance of the health system in the Cayman Islands is derived, as I understand it, from 2 points: the HSA's billing system and the Cayman Islands National Insurance Company's claim system. I wonder, can the Honourable Minister explain what is being done to improve the quality of information that is being provided in terms of the delivery of healthcare in the Cayman Islands?
Member, I think that we probably have your questions in the wrong area, because we're doing with health regulatory services, that the registration of doctors, nurses, healthcare facilities, that sort of stuff. There are other appropriations where we can ask that type of a question. Is that okay?
Thank you, Mr. Chairman.
Mr. Chair, I think I may have my question right in respect to this line item this time.
Please.
Through you, Mr. Chair, is there any proposed changes to the regulations in respect to qualifying doctors in the minister's plan to create a better, affordable health care service to Caymanians? Because I know the minister is something important to him to make sure that we change the system in a way that there's affordable health care and services. And there's been much talk about changes to qualifications and stuff and the likes for health service providers. Is there any proposed plans by the minister and the ministry in respect to that?
Through you, Mr. Chair, one of the things on the ministry's work plan for the coming budget period is to do a comprehensive review of the health practice law and the health practice regulations, which is the legislation governing the registration of healthcare providers. And issues like the minimum level of qualifications and so on are all going to be part of that discussion. So that review is something that is on our work plan for the next budget period.
Mr. Chairman, just a point of clarification. If the Honourable Minister can point to the appropriate appropriation that relates to the performance of the healthcare system so that I can ask my question at the appropriate time. I'm having difficulty trying to identify which appropriation output group that question would otherwise apply to.
I think HES 8, it would be appropriate.
Thank you, Mr. Minister. HES 8.
We'll take it on there. Member for Newlands.
Thank you, Mr. Chairman. Just looking at HRB 10, Health Insurance Complaints Resolution, I think that falls under this subheading. Number of letters and notices, is that any indication of the volume of complaints?
Mr. Chair, through you. It's to do with a number of different things. Some of it is in response to complaints about from insurance companies, from healthcare providers, from insured individuals. It's also to do with tracking policy terminations. So on a monthly basis, the health insurance companies are required to notify the Health Insurance Commission of any policy terminations. Part of the Health Insurance Commission's work, which I think is reflected in here, is to follow up on those terminations to try and determine the nature of them and see if it's a situation, for example, where an employer has now fallen afoul of the requirement to have health insurance, whether they haven't been paying their premiums, and so on.
Okay, so it's a mix then. In terms of complaints against insurance companies, you have an idea what the volume, what level, average volume you're experiencing?
Through you, Mr. Chair, the minister did have this information in his speech, and we're just finding it.
I recall that. I can't remember
Yeah.
the figures.
Mr. Chair, through you, we've been advised by DHRS they have approximately 500 health insurance-related issues they need to address every month, and that would include the termination follow-ups I spoke of, complaints against healthcare providers, complaints against insurance companies, and so on and so forth.
Are we tracking in particular, the complaints against insurance companies? And I'm not picking on them, but as a representative, those are the ones I hear about the most. In terms of premiums being too high or insufficient coverage, I've had some complaints about what is known as the SHIC plan, where a lot of insured individuals feel like they're not getting the coverage they need. Are these figures in these complaints being used to craft policy going forward and make changes to improve health insurance coverage?
Through you, Mr. Chair, yes, the Superintendent of Health Insurance and his team will make recommendations to the Health Insurance Commission on the basis of what they see in some of these complaints. One recent example is that it came to their attention that we amended the standard health insurance contract, or the SHIC plan, in 2013. And we increased the benefits under that plan significantly to include, one of the additions was to broaden the dental benefit. And it was brought to the Superintendent of Health Insurance's attention that one of the complaints that we were seeing was that people with that SHIC plan were not able to get their dental claims covered. And it was due to a technicality in the legislation that we hadn't been aware of previously. As a result of that, the superintendent and his team made a recommendation to the Health Insurance Commission, who then made a recommendation to the ministry to amend some of the wording in the legislation to make sure that those dental claims would get honored. And as far as we're aware, going forward, that has been the case. So there is definitely a system of sort of feedback and continuous monitoring by the team at the Department of Health Regulatory Services and the Health Insurance Commission to identify recurring issues that they're seeing in terms of making recommendations for change.
And is there any work now being done to look at the level of
Member,
premiums?
can I just ask if you direct your questions through the chair?
Sorry, Mr. Chairman.
Not trying to be mean to you,
No.
but just
Protocol. Through you, Mr. Chair. Is any work now being done to address the complaint, the common complaint that premiums are too high in relation to coverage, and especially for aging individuals who are retiring and need to have continued health insurance coverage? They're finding it very expensive to pay premiums for anyone who's over retirement age.
Mr. Chair, through you, thank you. That's a Very good question, and I'm glad you brought that up. We just put a new board in place, a very able and capable board that is looking at the SHIC 65. What we found is that persons over 65, once they retire, their employer that they're working for don't allow them to carry on their health insurance plan. So they're found then without health insurance and at a stage where they actually need coverage at that age. So some of the considerations is to try to work the plan in such a way that a lot of the things that 30-year-olds would need, 65-year-olds would need, like maternal care, etc. So we're actively trying to get a plan presented for caucus as soon as possible.
Well, I'm glad to hear that. Is there a concern, through you, Mr. Chair, that the number of insurance providers on island may be playing a role or a factor in the high premiums? Because we don't have the actual information for us to determine that ourselves, but that is a feeling in the community that there's so many insurance companies fighting over a limited pool of customers, and some feel that that's causing an increase in the premiums.
Through you, Mr. Chair, I must say that the SHIC is regulated, but not the other programs. But and I must admit that is the feeling, and there's some conversation going around about the amount of insurance companies on the island, not to scare anyone or to get involved in the businesses of this nation. But I think that if we expand Cineco a little bit more, in my opinion, that we may be able to get a better result.
Mr. Chairman. Mr. Chairman.
Oh. Member for Savannah, go ahead, sir.
A couple of things. The last finance minister, your predecessor, was looking at bringing the authorities under Cineco so that we would all benefit from scale with the numbers of people insured. Is this still being considered?
I can tell you, from my perspective, what I know that is still an ongoing project within the government and probably this wider civil service with regard to from the total standpoint of trying to control the healthcare costs. So it is part of the ongoing project that is taking place.
Yes, I'm glad to hear that. The minister, through you, mentioned the SHIC 65. I know a lot of the retired and elderly people are very looking in anticipation for something like this to come up. I guess it'll be a while before you get the costing, but I would certainly urge through you to the ministry that this be looked at. The other question I wanted is in regards to how does the different councils verify the credentials of professionals wanting to be registered, from where they came from, how trustworthy the information is and stuff like that.
I just want to thank you, through you, Mr. Chair. In terms of the SHIC 65, one of the main reasons why we thought that we should create such a policy was the cost. Well, I'll allow Chief to answer the second part of your question. Thank you.
Thank you, Mr. Chair. Through you, one of the requirements for registration, for an application for registration, is a letter of good standing from the jurisdiction that the individual practitioner is currently registered in. So that's one of the things that they look at. They're also required to provide evidence of their educational certification, any other registration that they have, and so on. So the application checklist lays out the supporting documentation that's required. The team of administrative secretaries at DHRS will review the application, review the documents, verify some of the things that they need to verify, whether it be through, for example, I'm aware of some instances where they've contacted a university to verify that the degree that's been provided, that the person has in fact graduated. The letter of good standing that's provided is provided directly from that registering council and not through the applicant. So it's from council to council that letter of good standing happens as well. So there's a bit of verification already built into that particular process. And just to add to what the minister mentioned, the work for looking at the feasibility of a SHIC 65 has already commenced. So we are moving ahead with that.
Thank you very much. Through you, Mr. Chairman, the professionals, are they required, or most of them I know are, the continuing CMEs for their, is that still being required? Continual medical education.
Through you, Mr. Chair, the CME requirement is a requirement for retention of registration. I'd have to verify whether it's required for initial registration. I think the letter of good standing from the other registering council would be taken as the fact that they are current with that council in that jurisdiction. But certainly the requirement for our practitioners, once they've been licensed locally, to renew their license, they need to provide evidence of having completed a minimum number of continuing education hours, which are vetted by the relevant council.
Mr. Chair, through you.
Member for Georgetown Central.
Thank you, Mr. Chair. Has the minister and the department, or has the department ever done any analysis or any document to whether universal health care would be an option for the Cayman Islands, what the pros and cons of it is? Has there ever been any analysis done before?
Through you, Mr. Chair, I'm not aware about any analysis being done, but what I can say is that this is an active discussion that we're having and looking at all options.
Mr. Chairman, just quick question on the registration and certification of health professionals. And correct, through you, if the minister could correct me if I'm wrong, but my understanding is that for doctors working at the Sheddy Hospital, there's a different registration and licensing regime in place for them opposed to other local practitioners. Is that still the case?
Mr. Chair, through you, what the member is referring to, I believe, is the category of institutional registration.
Yeah.
So there is, within the amendments that were made to the health practice law in 2013, one of the amendments was the creation of an institutional registration category for registration of practitioners. The legislation before that for registration on the principal list restricted registration to qualifications from 7 different countries. Some of the things that we at the ministry had been hearing were around how to recognize practitioners, whether they be doctors, nurses, pharmacists, medical technicians from jurisdictions other than those 7. And so what was proposed and what is now in the legislation was that a healthcare facility could apply to Cabinet to be designated as a facility that is eligible to employ institutionally registered practitioners. The requirement for registration on the institutional list is the same requirements as what you would have on the principal list, the only difference being the jurisdictions where you have undertaken your qualification. So you still need to satisfy the council regarding that you have adequate education, you have adequate experience, you have satisfactory knowledge of English. The criteria or the boxes that you need to tick are the same. It's not a second tier of qualification or registration. It was just put in place because we recognized that it wasn't as simple as adding some more countries to the list, and it wasn't the same across all of the categories of practitioners in terms of which jurisdictions they might want to have practitioners come from. So that's the institutional registration, but it still requires the same level of vetting by the relevant registering council. You're still required to satisfy them of the same items. The main difference is regarding the jurisdictions.
And Mr. Chair, thank the Chief for that comprehensive response. And I also want to note, because we're in a public setting, that the outcomes at the Health City has been very good.
Thank you, Mr. Chairman. I actually only asked the question because I take note that we are looking to form closer ties with the institution and work with them and provide local health care for Caymanians. So I just wanted to make sure there were no liability concerns as far as registration of physicians, and just ask for assurance on that. That was basically why I asked the question, because I do support
Member for Bodden
moving.
Town.
Yes, Mr. Chair, thank you. It's a very good question. And in terms of, we don't really know all of their business plan in terms of the intent purpose for Health City was to improve, to provide tertiary care for the persons, the Cayman Islands, to help the government, the country save on cost, mainly, with very professional and some of the best care in the world that we benefit from having Health City here. And they have been providing other services here in the Cayman Islands and working in conjunction with the HSA and other entities. But I must say that I'm proud that that the Cayman board is a team of the Cayman Islands, really.
Member for Bodden Town West.
Thank you, Mr. Chairman. Through you, sir. How many facilities do we have in the Cayman Islands that provide or that are registered to provide healthcare services?
Through you, Mr. Chair. As of September 2017, there are 144 registered and licensed healthcare facilities.
Thank you,
Overall,
Mr.
through
Chairman. Just as a follow-up, I noticed on page 115 of the budget statement is that the number of on-site inspection is roughly 9 to 12 per year. That's one of the minutes I think that is adequate in terms of number of inspection. If you have 244 and you're doing about 10 inspections a year.
Through you,
Go ahead.
Mr. Chair. The Health Practice Commission facilities license runs for multiple years, so it's not necessarily an annual inspection cycle. I do agree that those numbers look a little bit low given the number of facilities that are licensed, but the inspector works around the year to conduct the actual inspections. There's also a lot of other work that goes on behind leading up to the inspections as well.
So roughly, thank you. Through you, Mr. Chairman, multiple year as in how many, what's the normal length that the facility is licensed or inspected for?
Thank you, Mr. Chair. Through you, I believe that I don't have the legislation here, but I think the health practice facilities certificate is usually 2 or 3 years before it's renewed.
Thank you. Well, on that basis, Mr. Chairman, through you, sir, then we should be looking at around roughly 70, 80 inspections per year, because as licenses are multiple year based on the 244, even if they're using up to 3 years. Well, I'll just leave that one as is.
Okay, I was going to ask you if there was a question.
Yeah, that's fine. There's another question I have here. I noticed on page 114 of the budget statements, that there is also, again, advice and support to the Health Practice Commission Board, Councils and Ministry. I'm just curious in terms of what kind of advice generally this is. And I mean, is it different from the other policy advice that's there? And also, who's providing this advice?
Thank you, Mr. Chair, through you. This particular output for the department is to do with special projects or special advice that they would be required to give the councils if there was a particular issue that arose. It doesn't reflect, I mentioned earlier about the process for registration, that the admin secretaries review the applications. That's not reflected in this. This is more to do with if there's a specific issue or a special project that they require a particular piece of advice on.
Thank you. Through you, Mr. Chairman, I also notice again, HRB 15 is also in excess of another $250,000 worth of policy advice and reports to the Health Insurance Commission, Board, and Ministry. I'm just trying to understand, I mean, seeing that we already have a 1.9 million increase in policy advice, I'm trying to understand what this other $250,000 is for. And that's page 113 in the budget statement.
Through you, Mr. Chair, this is to do with the administrative support for the Health Insurance Commission, so the admin secretary who takes care of the minutes and convenes the meetings and so on. It also reflects when the superintendent of health insurance, for example, the SHIC 65 that we've been talking about, I think would be reflected in this output here, some of the work that is to do with that.
So, through you, Mr. Chairman, so this is just primarily staff costs. Just wanted to make sure.
Mr. Chair, through you, I believe this reflects staff costs as well as we've included some funds for an actuarial consultancy to do with the SHIC 65, and I think that's reflected in here.
Okay.
Thank you. Through you, Mr. Chairman, and I'm just getting into my last train of questions on this side. I noticed on HRB 13, which is also included on the HES 2, that there is a number of investigation conducted, which is roughly between 20 to 24, and the number of files prepared for legal department for prosecution is between 1 and 5. I'm just curious in terms of what is usually the outcome of those prosecution.
Through you, Mr. Chair. The member is looking for the outcome of the files that are prepared to DPP.
Yeah, true, Mr. Chairman. Yeah, roughly, is there like anyone get prosecuted, or what's the prosecution rate? I mean, according to this, it just says number of investigation conducted is between 20 to 24, and the number of case files prepared and submitted to legal department for prosecution is between 1 and 5. So I'm just trying to get an outcome or get an idea in terms of if people are actually convicted or they're found guilty, and then what?
Through you, Mr. Chair, one of the amendments that we made in 2013 to the health insurance legislation included a provision for administrative fines for violations of the health insurance law. The superintendent of health insurance has successfully used that provision to have employers become compliant if they weren't paying, for example, and so on, and so that I can get the detailed statistics for the member after the meeting and provide them to him in terms of the number of complaints that have been resolved or investigations that have been resolved by the administrative fines vehicle, as well as the number of cases that are currently pending in terms of prosecution to the courts.
True, Mr. Chairman. Just so I'm clear, the administrative fine, is that something that still goes through the legal department, or is that something that is done by the commissioner?
Through you, Mr. Chair, the process for the administrative fines is through the Superintendent of Health Insurance and the Health Insurance Commission under the health insurance law.
Okay, good. Well, follow-up question through you, Mr. Chairman. Then those that goes to the legal department, then I guess those would be the ones that are outside, or I guess a little bit more serious, that they send them to the legal department for prosecution, and those are the ones that we that I would really like for the public to know what has happened with those in terms of those prosecutions.
Through you, Mr. Chair, the member is correct in saying that the ones that go to the DPP for prosecution tend to be more serious in nature. The health insurance law lays out which offenses are eligible for administrative fines versus which ones must go through the court system. There's also situations where even though the legislation allows for an administrative fine, the person who's subject to the potential prosecution opts to go through the court process instead. We've had a couple of cases like that as well. The Health Insurance Commission does report regularly on the outcome of the cases once they've been to court. I don't think we've had any recently. We currently have 4 that are pending through the court system, and we don't have the outcome of those ones yet.
Thank you. And my last question, Mr. Chairman, through you, sir. It relates to HRB 11, administer the segregated insurance fund and the number of insured person. Just out of curiosity, how much is collected from this fund? And just for, the clarity of the public, you can just explain to them what this fund represents. Thank you.
Go ahead.
Through you, Mr. Chair, I don't have the exact figure of what's collected in the fund. The segregated insurance fund is the amount that is collected against every health insurance policy premium that is meant to be, it's a contribution to offset the cost of health care for the indigents. The fund currently collects between $4 and $5 million a year. The insurance companies are required to report and submit their returns on a monthly basis, and it's based on the number of insured persons that they have on their book of business. It's I think it's $10 per individual and $20 per family that is tied to the segregated insurance fund.
And through you, Mr. Chairman, all insurance companies are up to date in those payments?
Through you, Mr. Chair, I've been advised that that is the case. All the insurance companies are up to date in their contributions.
I put the question. All those in favor of HES2, Health Regulatory Services, $1,368,280 in 2018 and $1,442,000 in 2019. Standing part of the schedule to the bill, please say aye.
Aye.
Those against, no. The ayes have it. HES7, Collection, Recycling and Disposal of Waste, $4,102,547 in 2018 and $4,225,398 in 2019. Are there any questions?
Yes,
Member
Mr.
for Boddentown West.
Thank you, Mr. Chairman. I noticed that the spend is actually decreasing from 4.8 million annualized in 2016 to 2017 to 4.1 million in 2018. I understand that the decrease is largely driven by collections that have actually garbage fees collected. So I am just like through you, sir, to the Honorable Minister, the extra 700,000 in collection, what is pretty much driving those efforts in terms of which would have offset the cost?
Thank you, Mr. Chair. Basically, it's the pay stagnation and fuel costs that is driving this.
Actually, Mr. Chairman, through you, sir, the costs actually went down annualized. So I think the pay stagnation would have actually carried the costs up. So what we're looking for is actually the anticipated revenues, because the revenues is what also offset this cost. As per the notes on page 106 and 98, page 98 and page 106 of the budget statement. Sorry, 98, yep, and page 106. there are notes there that refers to collection. I was trying to prior to the meeting, the Honorable Financial Secretary was actually trying to explain some of this to me to his credit. But we're just trying to understand then that since the cost is coming down and it is subject to revenues being increased, then we're just trying to understand, and especially now that we're aware that there will be increases of pay stagnation, then it means then that the cost would have actually gone up. So that means the revenues would have even gone up even more. So we're just trying to understand where the additional revenue is coming from to offset this cost.
Yeah, thank you, Mr. Chair. I think the member is correct, and there's some other third-party revenues, and I'll allow the director to answer your question.
Roy Dale Carter, Director, Department of Environmental Health. Mr. Chair, through you, the reduction would be allocation of revenues that would be collected from third party that is distributed across that particular output.
And thank you very much. Through you, Mr. Chairman, just year on year, what kind of collections are we looking at between this year and also for next year and the year after?
Through you, Mr. Chair, the revenue projection year on year is usually 5 to 10% increase, but the revenue that comes from third party is approximately $3.94 million each year.
Sorry, I'm just sorry, Mr. Chairman. I'm just looking for a total in terms of just the revenues. Revenues 2018 this year, revenues 2019, and revenues 2020. That's all I'm looking for. Thanks.
It's 2.3. That's what it is. Yeah. Through you, Mr. Chair, let me just say that the total cost for this fiscal 2018 year is $4,229,926. And of this amount, that is that's expenses. And of this amount, $2,345,300 is from third-party revenue. And the difference is offset from like cabinet of $1,884,626.
Thank you, Mr. Chairman. Through you, sir. And what are we projecting for 2019 and 2020 in terms of revenues from third party?
Yeah. 1 second. Through you, Mr. Chair, the revenue projections through 2019 is $2,435,975,000. 2020, Mr. Chair, since we're doing the 2-year projection at this time, we don't have that projection. That would be
and that's
based on
beyond the scope of our examination right now anyway. So I would just, we'll limit it to 2018 and 2019.
Sorry. I mixed up. I forgot I was asking about. And 2017 revenues, you said was the two, sorry. What was it for 2017 for the third party? Sorry, for the current year.
Mr. Chair, through you, the revenues that I gave was actually for 2018 of 2,345,300, and the revenues for 2019, 2,435,975.
Okay. And the revenues for the current year, for 2017, this 12-month period, are projected or forecast?
Mr. Chair, we're allowing the CFO to come and answer some of these questions.
Mr. Chair, for the 2017-18 is 3,345,000. 18-month period, Mr. Chair. 3,345,000.
Thank you. Mr. Chairman, here's where I'm getting at with this line of question. And naturally, Mr. Chairman, you'd expect that the collection, recycling, disposal of waste is one of the things that is very important to the public. And this is, the garbage collection has been one of the things that many of us, or all of us inside here, at some point would have to deal with in terms of frequency. What I was trying to understand, Mr. Chairman, and through you, sir, is that the amount of cost that is being looked at is being reduced from 4.8 million roughly annualized to 4.1 million next year, which is a decrease of 700,000. And what I was looking for was an offset, an increase in revenues to say, well, because if anything, I would expect the cost of collection of garbage to be going up. So if the cost is being reduced by 700,000, I was looking for an increase in revenues of at least more than 700,000. And based on these numbers, I'm seeing an annualized increase in revenues of going roughly from 2.2 million annualized over a 12-month period to 2.3 million. So that's roughly 100,000 increase. So what I'm trying to find then is this a genuine reduction in the cost of picking up garbage and the collection of garbage, or is this a situation where we have under budgeted, but there's a 600,000 gap between the numbers that are presented here versus what is actually happening? We're trying to understand what's a 600,000 shortfall or the decreases in year on year. That's really what I'm trying to get to. Thank you, Mr. Chairman.
Mr. Chair, through you, the expense that's related is specific to that particular output, but there are other expenses that are also associated with different outputs within the department. So that is hence the reason.
What was that? Sorry, Mr. Chairman.
Go ahead, sir.
Hmm?
Go ahead, sir.
No, I didn't hear the answer. Sorry.
Yeah. I didn't think you'd completely. I wondered if,
Okay,
if there's
sorry.
more that you were trying to get to.
Mr. Chair, yes, I said earlier that the revenue that's allocated to that output is related just to a portion of the outputs within the department. And then some of the revenue is also allocated to other outputs within the department.
Mr. Chairman, apologies, sir. I recognize, again, I can only go by the information that is presented here that the finance minister put together. And what the information presented here says is that the cost for collection, recycling, disposal of waste as per HE87 is moving from an annualized 4.8 million to 4.1 million, which is a decrease of 700,000. Now, I do recognize that this department is allocated a certain amount of revenue. Now, if it is a situation where that the government has budgeted less for the collection of garbage, then if that is the answer, that is the answer. But then, which would then lead me, the other question is that several years back, Mr. Chairman, you may recall that the government increased the duty from 20% to 22%, and part of that was to offset in terms of the collection of garbage and basically not charge homeowners to that amount. So if I'm seeing now, if it's a genuine situation where less money is being budgeted for the collection of garbage, then so be it. But I was just trying to understand why there was a drop of 700,000 in terms of for this year as opposed to next year.
Mr. Chair, through you, let me clarify what I intended to say earlier. The revenue reduction that you speak about in 2010 in particular, when there were some issues with the garbage fees as to the reduction in garbage fees, and you mentioned about a certain percent added to fees. But during that time, we used to actually bill all of the residents and households. And since 2010, we have only been billing those customers who actually have a container service associated with their particular business. So there would have been an overall reduction over a period. So hence, the overall revenue that we were collecting previously has also been reduced.
Thank you, Mr. Chairman. But then, I mean, the 2% increase in customs duty from the 20 to 22%, that is supposed to be going to the Department of Environmental Health for the collection. So the question is then, through you, Mr. Chairman, what percentage of that 2% of the 22% is that being used for? Because technically, even though the households stopped being billed, we were paying for it through the increased duties. So it was just a efficiency in terms of collections.
Mr. Chair, through you, the 2% that the member refers to, I believe, goes into general revenue and is being reallocated through this budget process. It's not in a restricted fund or ring-fenced for the Department of Environmental Health.
Then, Mr. Chairman, through you, sir, then the next question then would be, well, here's where I'm still a bit lost, Mr. Chairman, and I'm sure you as an accountant will also understand. We're trying to find where the 700,000 annualized decrease, if it means that there's going to be less collections next year, or I'm trying to understand why this cost has dropped significantly year on year.
So the difference is 700,000. Mr. Chair, through your, let's see if we can get this right. And the difference year to year would be that we are funding more of the expense or the cost of that particular output than we did previously. In other words, again, because with the whole budget, and you may see this probably throughout the documents, and you've probably in others, is that when things shift from one output to another, it also carries a certain percentage from allocation to another vote. But we are actually contributing a bit more, so the reduction is offset between either what cabinet would have given us and then what we are paying, contributing with revenue from collected revenue. I'm not sure.
Thank you, Mr. Chairman. Thus, my original question, where I was asking about the collections, and based on the numbers presented, the increase in collection is only 100,000 year on year, but the decrease in cost is 700,000. So it means that there's still a $600,000 gap. And it is that gap now we're trying to understand. Is there a situation where a decision was made to reduce the number of weekly collections for garbage? Or I'm just trying to understand that, Mr. Chairman, and thank you.
1 second. Yeah. You can do that. You can do it.
Mr. Chair, in the essence of time and not trying to avoid the answer, but we will bring that information back so that the member can be furnished with.
Member, you happy with that approach so we can interested moving forward?
Member from Bontown West.
Well, the thing about it is, Mr. Chairman, I actually do need the answer, because one of the things, as part of my follow-up question, is that if custom duty was increased by 10% from 20% to 22%, and that increase to the taxpayers was predicated on the increase largely being driven towards the provision of garbage collection, then I would, at a minimum, I would be expecting that around 10%, or not close to, of the revenues from customs, from all the importation, should have basically been going towards environmental department, because that's what it was there for. So from that situation then, and then considering that that number has been going up, and also that the frequency of garbage collection has been going down, I'm just trying to, in the public's interest, trying to get an understanding.
Well, I think it was explained, though, if I might interject a little bit. When the increase in duties was imposed in 2010, I do not believe that certainly the law was not amended to specifically direct those for garbage collection as such. I think the chief had indicated that. And I think it's also important to bear in mind that since 2013, that there was a bit of a rollback in that fee as well, in that for licensed importers, that the fees import duties were reduced back to 20% rather than the 22.
And
So I want to say that by way of clarity.
and yes,
Minister?
no, I just wanted to clarify that it wasn't from 10% to 22%, but
No, it
more
was
20 to 22.
20 to 22, but 20 to 22 would be a 10% increase.
Yes.
Sure.
Yeah, so
Mr.
we
Chair.
undertake to get that information for the member from Bordentown West.
Mr. Chair, Mr. Chair, through you, and by all means, I am no accountant here, but I got what my good friend Steve Markfield calls good old Cayman common sense. And based on what the member from Bordentown West is suggesting, I'm a bit confused because he's suggesting that there's under budgeted from the previous year. And based on my calculations just now, the 2016-2017 budget was 4.7 million for 18-month budget. And if you annualize that, you get 3.18 million. The current projections right now, including what Cabinet will provide and other revenues, come up to the amount of 4.2 million. That's an increase, not a decrease. So I'm lost to the point because I want to understand what he's saying as well.
Okay, I'll explain. Through you, Mr. Chairman, I'll explain it to you. Kenneth, you take 7 million on page 209. You take
Member.
through you, Mr. Chairman. You take 7,231,245. You divide that by 18 and then you multiply it by 12. That's how you annualize it, because that's an 18-month number. Thank you. And then you see that works out to 4.8 million, and then 2018 it drops to 4.1 million.
Thank you. Please don't talk across the aisle.
Mr. Chairman,
I
in the
just want
interest
to
of
make sure
time,
you're comfortable. In the interest of time.
in the interest of, can we just skip this one and move to the next one, and we can come back to it?
Okay, if you
Thank
want
you,
me
Mr.
to,
Chairman. Yeah.
I'm happy to go ahead and let's defer.
Thank
Let's
you.
try to get the information. Let's move on to HES.
Mr. Chairman,
Yes, sir.
pardon me, but does that means that questions relating to other matters under this head will be able, other members will be able to ask?
When I come back to it, we'll be able to
Yes.
ask questions.
I just want to make sure that's
Yes. Pardon?
Can we continue with other questions?
Okay, and well, I'm happy to do that.
Yeah.
Well, okay.
Mr. Chair, I have two questions in relating to this seam line item, if I can ask those now. There's not in respect to the numbers. So one of my questions through you, Mr. Chair, to the Minister, what is the policy on collection of bad oil, say, from the likes of garages, and what's the policy? Because one of the things I noticed, particularly in my constituency, is there's a lot of garages, and by all means, I know they're all working hard and the like, but used oils is a major thing in respect to the water line and the damage to the water line in the Cayman Islands. The water lens, particularly for Georgetown. When I grew up, well water used to be all right to bathe in and clean and it didn't smell bad, but nowadays there's no way in the world you can even think about using well water. What is the enforcement policy in respect to mandating that persons who use these types of chemicals that they have to be disposed of, and how is that process done?
Okay.
Mr. Chair, through you, there is a used oil recycling program, and there's pretty much a partnership with most of the facilities. In fact, a lot of the garages save their used oils and bring them to the landfill for processing, and we sort them, test the oils, and then ship them overseas for further processing, either as used motor oil, which is clean, and then or contaminated oil. And at this, if I can just say from just based on 16-17 year, we processed contaminated used oil of 12,000 gallons, and we shipped contaminated used oil of 6,000 gallons. The department processed some 116,000 gallons of uncontaminated motor oil, and we shipped off island 97,600 gallons. And we also processed uncontaminated cooking oils of 10,100 gallons, and so far we have shipped used cooking oils of 5,300 gallons. So those quantities are actually being brought into the landfill, and we are actually processing and shipping what we can off island.
Thank you, Mr. Chair. Thank you for that answer. And that's good information to have in respect to the oils that are being collected by those persons who are responsible to bring it to the landfill. What my concern is about is those who violate the policy for our environment in respect to making sure that they bring it to the landfill. Hence the reason my word enforcement, because sadly there's a lot of people who will just throw the oil potentially on the ground or don't dispose of it correctly. What are the policies in respect to that, and how many violations have you seen? Are you concerned about it? What's your thoughts on that?
Mr. Chair, through you. Certainly illegal disposal of oil cuts across a number of agencies, such as the Water Authority, who is responsible for groundwater monitoring. It is a concern for the Department of Environment, and certainly environmental health. And where we would tend to find more of this type of oil is at probably illegal garages or the processing of derelict vehicles. But you may also have people disposing of it elsewhere. When the Department of Environmental Health is in possession of such information, an inspection is conducted. We involve other agencies as well, and abatement or enforcement notices are issued on the perpetrators, and that has been the process, given time to have it cleaned up. There are also at times that the petroleum inspectorate is involved depending on the nature of the spill, because they're responsible for the service stations and et cetera, and they work in partnership as well with the department. But certainly in terms of an illegal disposal, whenever we come across that, we try to, as a multi-agency, address it.
Through you, Mr. Chair, I recognize that there's a lot of educational elements of some other line items, and I don't want to speak to those because we haven't reached them yet. But my question in relation to this is proper disposal of those types of materials. Are they related or transferred to the garages that we speak about? I guess only to the licensed one. The ones that are not licensed, is hard to disseminate that information. But my question is there an education campaign in respect to letting people know what their obligations are and how they can get it done in respect to delivering it to the landfill?
And Mr. Chair, through you, certainly there will be more effort in that regards. We have recently filled a public relations officer post, which was vacant for quite some time. So there will be increased public education. So I do take note of the members' comments.
Can move on then to H. We're going to park HES 7 and take the vote later once we get the information.
Mr. Chairman, I had one quick question. Just on the, if you'll allow, sir.
Is it a quick question, or are we going to get multiples? I'd prefer just leave it and come back to
Or
it.
when we come back to it, I can
Yeah,
ask.
no, that's fine. We agree to, we leave it on HES 7. I was only trying to move the
And I try and hold your progress up, sir, but there are many questions to be asked here because this is the area with disposal,
yeah.
and we are right in the middle of trying to do something about that, and this is where the questions
Right.
have to be asked. But I'm not trying
Let
to
us-
stop you, sir.
All right, let us move forward. Member from Newlands, please ask your question.
Okay, just looking at the subheading, EVH 18, are we meeting the residential collection schedule? And could you tell me what that is, just so that the public is aware?
Let's make sure I got EVH 18. Mr. Chair, in regards to residential waste collection, that is the provision of garbage services to residents throughout per household. This excludes any of the commercial customers that may have a commercial bin or container at the property. So basically, it would include the other customers. And specifically, there's a schedule for collection. I will say that it's not always on time as we would love for it to be. That is our endeavor to get it there. Currently, it is once a week at this particular time. And the service schedule is from the Western District or in West Bay on Monday, and moving into Georgetown, a good portion of Georgetown is on Tuesdays, and Prospect area and Crew Road is on Wednesdays, and Thursdays in Savannah, Newlands, Spots, and Fridays in Bordentown East End, North Side. So it is a once a week collection currently, and I think the whole issue with the actual trucks and so forth is one of the reasons why we are with the actual collection as it is, and we currently are operating with. It has to do with the reliability of these trucks, which we are actually working on. The committee will recall certainly that we did receive some equipment some time ago, 2013-14 years, but the fleet itself was not complete. So what we are actually having to deal with now is the remaining portion of that fleet. And this is the same fleet, the majority of, or the remnants of the fleet that we had in service prior to Hurricane Ivan. So the fleet has served its purpose, and with the new vehicles that were replaced, especially in the residential collection, we are actually double shifting those to ensure that we try to meet the demand. So I just wanted to make that clear, and hence the reasons with some of the collection issues at residential properties.
So based on that, through you, Mr. Chairman, we're at about 50% effectiveness then.
Through you, Mr. Chair, in terms of actually because what we use for the residential collection is actually the rear loaded trucks. So yes, the number of trucks that we would need to actually do collections in one run or one shift, ideally is 8 trucks. and we would need at least a couple of trucks as backup to ensure that we have consistency in service, because that is what we're striving for. And until we get that fleet, it's always going to be a challenge. Even with the new fleet, like I mentioned, we have four of the newer trucks on Grand Cayman, and there are 2 or 3 other old ones that do limp along periodically. And when they're up and running, the service is good, but when they're down, it creates a problem. The other aspect is that through the new vehicles that were purchased through DVS also come with a 3 or 4 year warranty service. So they have to be taken out at certain times during the year to maintain that warranty service. So during that time as well, if there are any issues or the service was likely to suffer a little bit during those times. But we still collect the waste as soon as possible. Normally it would be the next day service collection. So yes, we are not as yet operating at the level that we aspire to be, and it is with great effort that we're trying to get there.
Thank you, Mr. Chairman. Through you, what are we doing to fix it?
And thank you, Mr. Chair. And like yourself, member from Newlands, we all get the calls about garbage and 1 or 2 days delay in collection and so forth. The ministry, we found a creative way we found that this was unacceptable in terms of collections and the way that the shifts are running. They're running the staff ragged. And we found a very creative way of, and we had to make an emergency decision in terms of trying to up the fleet by an additional 50, try to get 50% additional fleet. And that process is underway, and I estimate, I stand to be corrected, but I estimate by the first part of 2018 that we should be back up to full capacity and collections on schedule twice weekly. But definitely we just secured funds to order an additional 4 garbage trucks, which is something that we're very proud about.
Thank you, Mr. Chairman. Through you, so those funds are in this current budget?
In this year's budget. That's why it wasn't scheduled for this year.
Okay.
But we, in our EI, we found funds and reallocated to this very necessary purchase.
Thank you. What's the approximate cost of those 4 trucks?
Approximately, Mr. Chair, through you, it's approximately $230,000 a truck. And that's CI dollars with warranties.
New vehicles, I'm assuming.
Yeah, new. And one of the things that we discussed when I had the HOD meetings was in terms of the equipment and the longevity of the equipment was to try to, being we had the purchasing power of trying to get 4 one time, to try to negotiate some kind of maintenance plan where we would have regular visits. I mean, this was just a vision of mine from the persons that we're buying the equipment from, and to have a better maintenance schedule, as you heard us discuss yesterday with DVES, and trying to manage the situation that we get as much use out of the equipment as possible.
Mr. Chairman, just
Member for Beach
a quick question. I wonder if they can tell us where what is the manufacturer of those trucks? And their capacity at the same time.
Mr. Chair, through you. Actually, I would just like to make one clarification with the actual number. It's approximately 325,000 US dollars for the front loading trucks, which are 40 cubic yard capacities. With regards to the residential rear loading capacity trucks, which are 25 cubic yards, they are under $200,000.
Absolutely. Thank you very much. Don't come by they all 200.
I was referring to the rear loaders.
Mr. Chairman, I'm not saying nay, but I'm saying that those trucks, them front loaders, are extremely expensive. But it has always been Magnolia's somewhere under 150 for the rear loaders. It may have gone up some, I guess.
Yeah. Well, we're not ordering any front loaders. They were not requested at this time. So it's just 4 rear loaders, as I suggested.
Are there any more questions at this point?
Mr. Chair. Mr. Chair.
Yes.
I just want to make a public apology to the member from Bontown West. I see his calculations now, and I got the exact same thing in respect to the $700,000 difference. I was just missing out EVH5, so I do publicly apologize. Sorry, Chris.
Member for Bontown West. Pardon?
What was the question, Mr. Chairman?
No, I was asking if you had a question. I was giving way to you too.
No. I just want us to move on so we can try to get through this.
Fair
Thank you, Mr. Chairman.
Let's try to put this this vote to bed, because I think I have a response to the member from Bordentown West. If I'm allowed to, I can.
Yes, please do.
In regards to the question, member from Bordentown West, 700,000 was for the expanded recycling program in 16-17. The cost now shows that the third-party revenues can cover this, so it wasn't included in the 18-19 from the cabinet fund. There were no reduction in collection services as a result. The output 4 is disposed fees, which is funded entirely by third-party revenues, not shown here since since it wasn't cabinet funded.
Okay.
Sir, Mr. Chairman, through you, sir. I guess a little bit more confused now. And the reason being, and here's where I'm getting at now, is that based on the answers that we were given here today, when we have a 50% reduction in garbage collection, it means then that the cost for this year would have in essence been a little bit less than what it should have been. So worst case, it means then the forecasted cost for this year should have actually been more, which in essence means then that the gap that we're trying to find is even bigger. And then when you factor in now the pay stagnation where the good people are actually getting a deservedly pay increase, we're talking about roughly easily finding a drop of over $1 million. This really requires a little bit more thought, and what I'll do, I will wait, or we can, during the break to some extent, before we vote on it, I can meet with the representative and we can go through it just to at least get some level of satisfaction. But the reality of it is that garbage collection is down, and the funds to collect it or the funds to deal with it is also down. And from the public standpoint, that is unacceptable. But we can, I recognize it's complicated, so we can sit through the break. I know the staff is here, and we can hopefully just work it out and then report back to the House.
Okay. All right, well, let's move on then to HES 8, Public Health Services, in the amount of $1,801,733 in 2018 and $1,947,817 in 2019. Are there any questions? Member for Bodden Town West.
Thank you, Mr. Chairman. Through you, sir. I noticed that this group compromises of budget statement output EVH 11, and I noticed in EVH 11 that there's budget for construction of vaults to maintain cemetery capacity, and I was just between 100 to 120, and I'm just curious as to the location of where those additional vaults will be constructed, sir. Thank you.
That's a good point they're pointing out to me. Member for Bodden Town West, can we ask you to defer that question and the answer of it until we get down to EA 30, which is the executive assets for cemetery vaults?
Sir, Mr. Chairman,
Yes.
I mean, EVH 11, just looking at the quantity on page 102 of the budget statements, it says construction of vaults to maintain cemetery capacity 100 to 120. I'm just trying to figure out from an executive asset standpoint, where would that one be, say?
Okay.
Mr. Chair, through you, those vaults are constructed on Grand Cayman in the public cemeteries, and typically, just as a rough allocation of those, approximately 4 vaults is constructed annually in the North Side Cemetery, another 6 or so in 4 in Gun Bay, 10 in East End Main Cemetery. Bodden Town is about 20, and Prospect can be about, I think, around 60 where we're at with that. And now we're currently constructing about, I think, 12 or so within Boson Bay and West Bay.
Yeah. Thank you very much. I just also want to state, thank you, Mr. Chairman, through you, sir. I just also want to thank the Honorable Minister, because the last time he was here, he had fought to get the expansion of the cemetery in Bodden Town, and I really want to thank him for that, and from that standpoint. So that's the reason why I asked, but it is one of the things that it's sad that everyone has have to do it, but I know from our district that some people prefer to be buried in Bodden Town as opposed to be going to Prospect. That's the reason why I asked the question.
Are other questions?
Mr. Chairman.
Member for Prospect.
Thank you, Mr. Chairman. Through you, an opportunity to re-ask my question from earlier on. Healthcare costs are on the rise, but we do not know what is driving those cost increases. A recent Auditor General report suggested that we don't know because the 2 systems that are used to determine those costs, namely the HSA billing system and the Cynico claims system, are not being used to their full potential, nor are they being used to track performance management data inclusive of healthcare expenditure, patient outcomes, and other vital statistics. Can, therefore, the Honourable Minister explain what is being done to improve the quality of information that is collected and therefore used to determine the costs associated with the delivery of healthcare in the Cayman Islands.
Thank you, Mr. Chair. Through you, I think when we directed the member earlier, we had an incorrect output that we directed him to, but it does span, because it's to do with the entire healthcare system, it does span some of the outputs we've discussed previously. The Department of Health Regulatory Services and the Health Insurance Commission is working with the health insurance providers to look at some of the data that they get from them and whether we can get further information regarding some of the types of claims and costs of claims. We're looking at undertaking a review of the standard health insurance fees to see if they need to be addressed, because the cost has been an issue that's been raised perennial every year. And then I think when the Health Services Authority is up, they can speak in a little more detail to some of the steps that they're taking regarding some of their information systems and claims tracking and so on, that are looking to improve some of the information that's being fed into the healthcare system overall.
Okay. Member for East End.
Mr. Chairman, to the Minister, for years we have tried to separate the public health from DEH. The public health at HSA was always under Dr. Kumar, but there was that overlap. And there has been resistance to it. I don't know which quarter it came from. I really don't, because I've never, my good friend from Bardentown would know. But there has been some resistance to that, separating those two. Has this government considered revisiting that? It was public health there has been some overlapping between HSA and DEH. And there has been attempts to try and change public health and let it have its own law, its own guidelines, everything. And DEH has its own. So we would have two separate entities to deal with two separate health issues. But there has been some kickback against that over the many years. So I'm just wondering if this government has considered revisiting it.
Mr. Chair, through you, one of the member has referred to some work that has gone on. There was a proposal, I think about 9 or 10 years ago, to look at creating a standalone public health department. One of the challenges they came across at the time was that we have several departments that have some public health functions, but it's not their entire remit. And, there was a discussion around whether it made sense to split those departments into the operational and the public health, or whether to keep them together. And so we are in a situation where we do have a number of agencies with public health roles, And the team at Public Health at the Health Services Authority tends to act as sort of the coordinating body. We have multi-stakeholder groups that get together to look at things like disease surveillance, and they draw on the expertise in the other agencies like environmental health and MRCU when doing their work. The ministry is planning to review the public health law in the upcoming fiscal period, and it's quite in need of updating. And so if in the course of that review there's a suggestion that we need to look at the structures that we have and that there might be better functionalities achieved through realigning some of those structures, that's something that we will look at in that process.
Mr. Chair, I just have one question that I asked before, which is there any outstanding lawsuits against the HSA? And if there's any intentions and any allocations within the budget for settling?
Mr. Chairman, before moving on to that.
Mr. Chair. Oh.
Apologize again. I'm being advised that I should ask the question at a different line item, so I apologize, Mr. Chair.
Thank you, Mr. Chairman. In light of what the public health situation, when I was there as a minister in discussions with PAHO, Pan American Health Organizations, it was suggested at that time that the person responsible for public health should actually be within the ministry, and I know preparations were being made to that, but just to shed some light on, I know that has been considered in the past years to separate them.
Mr. Chair.
Member Freestad.
Okay. I want to endorse what he said, because that's the reason why I brought it up, because there needs to be a clearly defined line, because what we're getting is, Mr. Chairman, too much overlapping and animosities between the authorities, you know, and then we don't get to the point, the goal that we need to be at. And so somebody, I don't know if we're going to look at it, but it's a little concern. These school visits, who conduct these school visits, Mr. Chairman?
Mr. Chair, if I could just add to the response I gave earlier, that the member is correct in that there was a recommendation that there should be somebody at the ministry level who has an overall oversight responsibility for public health. That's one of the requirements for the chief medical officer job description, is a master's in public health and experience in public health. We're currently recruiting for that role with that requirement in the job description.
Yeah. Go ahead, sir.
Mr. Chair, through you, the school visits can be conducted by a number of people from the Department of Environmental Health, but the ones that are identified, they're pretty much mostly through the public relations section within the department. As I had mentioned earlier, that post was vacant for quite some time. It has been filled, or it was filled in June of this year. One of the things that I asked the post holder to do immediately was to reach out to all of the schools on the island, and that was done. And if I could just say that so far, we have completed school visits in Cayman to the Lebanese Scott High School, Spot Bay Primary, Creek Infant, West Bay Primary. We've also been to the Edna Moyle Primary School on the 8th of, scheduled for the 8th of November. We went there on the 8th of November. East End Primary School is scheduled for a visit on the 21st of November. And we are awaiting confirmation from John A. Cumber Primary School, Georgetown Primary School. In addition to that, Mr. Chair, we have also conducted some 3 educational tours of the landfill based on request from the schools. So we've done that for Johnny Cumber Primary School, and we have one scheduled for Cayman Prep High on the 16th of November, and we're also waiting on confirmation from St. Ignatius Prep School. And along that line as well, as chair, that we've attended a couple of career fairs as well during that time.
Thank you, Mr. Chairman. Mr. Chairman, I wonder if we can find out when was the last time this was done prior to those visits that we just heard of.
Mr. Chair, through you, the visits to the school, the environmental health officers or the public relations officer just can't turn up to the school and say they want to give some education on any aspect of environmental health. It does not work that way. We reach out to each of the schools, letting them know that we can provide the various services and what the services are that we can offer to the school. And the school, depending on their schedule and what they're actually doing at the time, they will invite us to come and give presentations to various sets of school or various classes. That is how it is done. But we are available at all times, and that has also been communicated to the various principals at the schools. And specifically to the question, I believe it would have been just prior to, so it may have been either late 16 that we may have been to East End Primary School, but I would need to confirm that.
Mr. Chairman, if I may, sir, I was not specifically talking about Eastern School. I didn't say that. What I asked was, when was the time prior to this that all schools were visited with a public health seminar or promotion or visits and talk about public health in general and what this country does and what the responsibilities are of the children. That is what I'm asking. Mr. Chairman, not all the time answers means you're wrong. Why? I don't know why people do that. The fact that you answer something doesn't mean you're wrong. It can mean we need to do something about that. And I see that in the schools.
Mr. Chair, I have the numbers for so far for 16, 17, which would give an indication of when last the schools were visited. And on the basis of that, we did four visits over the 18-month period last year. And like I mentioned, there was not a public relations officer in post, so we did at least 4 inspections or visits last year.
See, Mr. Chairman, that's all we need. So we'll know how we govern the country. We need to do something about that to get systems in place and find some way that we can address our children more often. That's what it is. It not that you could go jail because you didn't get there. You didn't have an officer, you didn't do this, you didn't have that. We need to ensure that we focus on that. That's one of the focus of this country for our children, that it's a must.
And Mr. Chair, and I agree with the member from East End. And with the new post now being filled, definitely undertaken to increase this education program.
Are there other questions?
Yes, Mr. Chairman.
Member for Newlands.
Thank you, sir. The indoor air quality assessments that are conducted, those are primarily focused on public buildings, I'm assuming. Does that include government buildings where personnel are working? And the schools?
Mr. Chair, through you, that is correct. These are on public buildings. For private undertakings, usually those are not included in these numbers, and they would have to pay for those services, or if we get involved in it, certainly all costs would be covered by the private.
Okay. And have you conducted any assessments of the Bordentown Civic Center? Air quality assessments?
Mr. Chair, through you, I do believe that there were an assessment done of this Bordentown Civic Center some time ago, yes.
Thanks. Do you recall what just generally what the results were? Through you, Mr. Chairman.
Mr. Chair, at this stage, I think we'll prefer to refer to the actual report rather than miscommunicating or misrepresenting something in that, so we could have you could provide access to that actual report.
Okay, thank you. Through you, Mr. Chairman. Why I'm asking that question is that I understand we still have civil servants working in that building, and they, I think, believe that it's mold infested. So if there is an assessment that is pointing in that direction, I would ask for some corrective measures to be taken immediately.
Okay. Member for Bordentown West.
Thank you, Mr. Chairman. Through you, sir. I noticed.
Before you ask the question, I think the director was going to respond to the request.
Sorry, Mr. Chair. Yes, what I could say broadly is that Bordentown Civic Center, I do recall there were some issues with it previously. There was a cleanup process at that facility, and it was cleared. If there have been other issues or concerns that have been raised again, I think then we'll need to know about that. But basically, for the occupants to be in the building, it would have been cleared or met the air quality standards.
Through you, Mr. Chairman. What I would ask then is someone follow up, because I'm hearing that there's still issues.
Member for Bordentown West, and then the member for West Bay North after.
Thank you, Mr. Chairman. Through you, sir. I noticed that this vote also includes EVH 9 in the budget statement that deals with food and safety and hygiene surveillance. And I'm just curious, sir, through you, is what provisions under the public health law that actually deals with food hygiene and safety? What part of the law in which we're operating under for that?
Mr. Chair, through you, the public health law does give the broad provisions to the medical officer of health, who delegates that responsibility to me as the chief environmental health officer to ensure that the food premises, as well as other nuisances, and the controller, their assistance with prevention of diseases or food-related incidences. So basically, the guidance comes from that through the Public Health Law 2002 revision.
Thank you, Mr. Chairman. Through you, sir. And that is exactly the point. I'm glad that the director mentioned the Public Health Law from 2002. And with so many changes that has happened since, the question is this: when is the Public Health Law is going to be updated? Because, as he said, it is a broad provision, but in terms of there have now been advances in other jurisdictions that deal specifically with food hygiene and safety. And I think that we need to start looking at modernizing our own public health law in that regard.
Thank you, Mr. Chair. Through you, as I mentioned earlier, the ministry is planning to undertake a review of the public health law early in the new year as part of our overall review, recognizing that there needs to be some amendments, that it has been some time.
Member for West Bay North, you have questions? Fine? Okay.
Mr. Chairman,
Yes, sir. Mr.
it may be under this head or the next one, but since the director is there, through you to him, been having some questions on getting the availability of bait and stuff for vermin, rats, and also for flies. What's the procedure to have that done, or how do you deal with it?
Mr. Chair, through you, we have a request and complaints line at the office. So basically, it would be a call to the office, and we would log the request for service. Then we would arrange with the complainant to provide bait in that particular area. And typically, the process is that whenever we do receive a complaint in a certain location, we try to bait a broader area to try to control the rodents in that particular locality. However, there are some issues as well with resources, and that may delay the service delivery to that extent, but we do actually respond in terms of dealing with the complaints. And we are not, I want to make it clear though, that we are not giving out the rodent control bait to the public. The officers will need to come and do the baiting or placing of the bait itself, simply because of a number of previous allegations and so forth about the indirect result of that. So we're taking the approach that we will do it ourselves. So again, based on that. But once we get the request in, we will attend to it.
Through you, Mr. Chair, what about the flies? Because I know someone said that about a month ago they had made a request, and I'm not sure of the response. I can't see that being that dangerous, that it could not be given to an individual.
And again, through you, Mr. Chair, the chemicals or products that we use that involves toxins, we always handle those ourselves. However, I believe that some of those products could also be acquired at some of the local hardware stores, I believe. So if the public is also interested in acquiring it from that angle, but definitely when a request comes in to the Department of Environmental Health, we actually deal with those things ourselves rather than give it to the public.
Especially with the mango season stuff coming up in another few months. Helpful.
I put the question, all those in favor of HES 8, Public Health Services, for $1,801,733 and $1,947,817, standing part of the schedule of the bill, please say aye.
Aye.
And those against, no. The ayes have it. I'm going to try to cover HES 9 before we take the break for lunch, if that's okay with members.
Yes.
So I'll go ahead. HES 9, Environmental Health Monitoring Services, $394,094 in 2018 and $420,608 in 2019. Are there any questions?
Yes, Mr. Chairman, and I'll accept your incentive to get through this quickly.
Okay.
I think we're all
Proceed,
hungry.
sir.
I just noticed, through you, sir, the budget allocation for this is actually increasing by about 56,000, but the number of complaints investigated and the number of the procurement of water samples is going down. It looks like. So I'm just wondering what the correlation there is. Cost is going up, but activity is going down. And in addition to that, just a quick comment really on the high-risk complaints within 24-hour response time. Yeah. Is that reasonable, or shouldn't it be maybe 6 hours or 8 hours? I'm just thinking that 24 hours is a little lengthy for a high-risk response.
Mr. Chair, through you, certainly part of the response have to do with resources available, but at least what we'll try to do is that based on the nature of the complaint, we'll try to get in contact with the individual to get more information, and if it is something that we'll need to respond to quicker, we will do so. And that's on the basis on which that is. So we would make that contact once it falls in that category. With regards to the other query that you had about the actual numbers for monitoring, I actually do realize that the numbers were actually misstated for the activities. For instance, the number of monitoring inspections should really be within 2,500 to 3,500, and also the number of procurement of water samples would have been 800 to 900, and the number of reports and correspondence should have been more than 1,200 to 1,500. So I just wanted to note those differences. I did recognize that.
Okay, thank you. That clears up my question.
Member for Bodden Town West.
Yeah, thank you, Mr. Chairman. And believe in me, I have no intention of standing in the way of anyone getting their food. But one of the things I want to point out, Mr. Chairman, through you, sir, is that when you look at the last 18-month budget, there in the planned legislation under the public health law, it basically says to update and modernize the law. And basically, for 18 months, basically nothing was done. So I'm going to ask the minister to really ensure that in the next 2-year budget, when they do return, that this is not one of the planned legislation again, seeing that it's still here after 18-month budget. I know it's in a 2-year budget. I just wanted to put that out there. Thanks.
Are there any other questions? If not, I will put the question. All those in favor of HES 9, Environmental Health Monitoring Services for $394,094 in 2018 and $420,608 in 2019, standing part of the schedule to the bill, please say aye.
Aye.
And those against, no. The ayes have it. Members of the committee, this is a convenient time.
Being HES 10 is such a relatively small one, probably the smallest in the lot. If we could take that, sorry?
I was just mindful that at this point, I think we've taken care of the director's matters for the director.
Oh, yes.
And it just seemed like more convenient for us to take the
But
break.
that's one more for him.
No, Mr. Chairman.
That's one more for him, you see. So
Which one?
Wanted to
I
try
think
to,
we have Park one.
Okay. Oh, that's right. No, I recognize we have to come back. Yes. Okay.
okay.
Okay. Let's go ahead and break for the lunch. It is 12:25. Let's be back at 1:30, please.